Blackheads are open comedones that develop when a pore becomes congested with a mixture of sebum, skin oil, dead skin cells, and sometimes residue from skincare, sunscreen, makeup, or hair products. The dark color is typically oxidation of the material at the pore opening when it contacts air, not dirt. And prevention works best when you reduce the formation of plugs inside follicles, keep the pore lining shedding normally, remove buildup consistently without stripping the skin barrier, and avoid chronic irritation and friction that trigger inflammation and rebound oiliness. The most reliable approach is simple and repeatable. Gentle cleansing that fits your skin type, a pore-clearing active like salicylic acid used consistently, a retinoid used correctly to prevent microcomedones, moisturizer to maintain barrier function so you can tolerate actives long-term, and daily sunscreen to reduce irritation and uneven tone. Everything else is optional, and many people actually worsen blackheads by adding too many steps, scrubbing too hard, or frequently squeezing pores. To prevent blackheads, begin by protecting the barrier because the barrier controls sensitivity, inflammation, and oil regulation. When the barrier is disrupted by harsh cleansers, frequent foaming washes, hot water, alcohol-based toners, overexfoliation, or abrasive scrubs, the skin becomes more reactive and inflamed and often compensates by producing more sebum, which thickens pore contents and makes plugs more likely. So the ideal cleanser is mild, pH balanced, and leaves your skin comfortable rather than tight or squeaky. Cleanse with lukewarm water, using fingertips, and keep it brief and gentle. Cleanser should remove excess oil and residue, not remove every trace of natural lipids. Morning cleansing should match your skin's needs. Oily or sweaty skin often benefits from a gentle cleanse in the morning to remove overnight sebum and reduce the film that can trap dead cells, while dry or sensitive skin may do better with a water rinse or a very mild cleanse to avoid starting the day with barrier stress. Night cleansing is the anchor for prevention because sunscreen, makeup, airborne particles, and product layers accumulate and mix with sebum. If you leave that film on the skin repeatedly, it contributes to congestion, so remove it thoroughly every night. If you wear long-wear sunscreen or makeup, or if you feel a persistent slick residue after a single cleanse, consider a simple double cleanse at night. First, use a gentle oil cleanser or micellar product to dissolve sunscreen and makeup. Then follow with a gentle water-based cleanser to remove remaining residue. Done correctly, this reduces the need for harsh scrubbing and lowers irritation. After cleansing, prevention depends on consistently changing what happens inside the pore. And two categories of ingredients are the most evidence-based for blackhead prevention: salicylic acid, BHA, and topical retinoids. Salicylic acid is oil-soluble, which helps it penetrate into the pore lining and loosen the bonds between dead cells that form sticky plugs. It can also calm inflammation and help with oil control, making it a strong choice for blackhead-prone areas like the nose, chin, and forehead. A leave-on salicylic acid product in the range of 0.5% to 2% is usually enough, and the most important factor is consistency without irritation. If you are new, start 2 to 3 times per week. Apply a thin layer to blackhead-prone areas, and increase gradually as your skin stays comfortable. If you feel stinging, persistent tightness, or see peeling that looks raw rather than dry, reduce frequency and increase moisturization rather than pushing through, because irritation makes pores more reactive and can worsen congestion. Retinoids are the long-term engine because they normalize follicular cell turnover and reduce microcomedones, the tiny invisible blockages that later become blackheads. By improving how cells shed within follicles and reducing the tendency for cells to clump, retinoids prevent new comedones and help existing ones clear gradually over weeks to months. If adapalene 0.1% is available to you, it is one of the most studied retinoids for acne. If not, retinol or retinol products can still help. But whichever retinoid you choose, the method matters more than the label. Use a pea-sized amount for the entire face. not spot treatment, because prevention is about treating the whole field where microcomedones form. Apply to completely dry skin at night to reduce irritation. Start 2 nights per week for 2 weeks, then every other night for 2 weeks. Then increase toward nightly only if your barrier remains calm. If you are sensitive, use the moisturizer sandwich technique by applying moisturizer first, then retinoid, then moisturizer again. This often improves tolerance while maintaining benefit. Mild dryness or light flaking can happen early as skin adapts, but intense burning, swelling, cracking, or a persistent rash means irritation, not a helpful effect. The correct response is to pause actives, restore the barrier with gentle cleansing and moisturization, then restart at a lower frequency. The most common prevention failure is stacking too many actives at once: salicylic acid plus glycolic acid, plus exfoliating pads plus scrubs, plus strong vitamin C plus frequent clay masks. Even though each can sound helpful, the combination often inflames the pore opening, increases sensitivity, disrupts the barrier, and ironically, increases congestion by making the follicle lining more reactive. A stable prevention routine usually needs only 1 pore-clearing active, salicylic acid, and 1 long-term comedone preventer, a retinoid, supported by moisturizer and sunscreen. Anything else should be added only after several weeks of stability, 1 at a time, so you can see what actually helps. Moisturizer is essential even for oily skin because a calm, hydrated barrier tolerates actives better and often produces less reactive oil over time. Choose a texture that fits your skin: light gel cream or lotion for oily skin, richer cream for dry skin. But prioritize non-comedogenic, fragrance-free or low-fragrance options with barrier-supportive ingredients, such as glycerin, hyaluronic acid, ceramides, panthenol, and possibly niacinamide if you tolerate it. The goal is not to eliminate oil completely. Oil is protective and normal, but to reduce the sticky congestion that traps oil in pores. A healthy barrier helps normalize that process. Sunscreen is another non-negotiable piece because ultraviolet exposure increases inflammation, slows barrier repair, and can worsen uneven tone and texture. When you use salicylic acid or retinoids, sunscreen also reduces sensitivity and helps you stay consistent. Choose a broad-spectrum SPF 30 or higher that feels comfortable enough to wear daily. If a sunscreen seems to worsen congestion, switch the formula rather than abandoning sunscreen, because the vehicle matters a lot. Lighter fluids, gels, or non-comedogenic, oil-free formulas often work better for acne-prone skin, and thorough removal at night is what prevents sunscreen from contributing to buildup. A straightforward routine that prevents blackheads without unnecessary complexity looks like this. In the morning, cleanse gently if needed. Apply a thin layer of salicylic acid to blackhead-prone areas, starting a few days per week, and increasing slowly. Apply moisturizer, then apply sunscreen. At night, cleanse thoroughly. Apply a pea-sized amount of retinoid to dry skin, starting a few nights per week and increasing slowly. Then moisturize. If you experience irritation, do not add more exfoliation. Instead, reduce active frequency. Keep cleansing gentle, moisturize more, and maintain sunscreen, because barrier stability is what allows the routine to work over time. A practical ramp-up schedule helps many people. Weeks 1 and 2, salicylic acid 2 to 3 mornings per week, and retinoid 2 nights per week. Weeks 3 and 4, salicylic acid every other morning, and retinoid every other night if comfortable. Weeks 5 through 12, salicylic acid most mornings, and retinoid most nights, with 1 or 2 rest nights per week if you notice dryness. The timeline matters because blackhead prevention is gradual. Many people see early improvement in 4 to 8 weeks and more meaningful change by 12 weeks because comedones form and resolve over cycles of follicular turnover, and swapping products too quickly prevents you from seeing true results. It also helps to set realistic expectations. Many dots on the nose are sebaceous filaments, normal structures that guide sebum to the surface. They can be minimized with the same routine, but they may not disappear completely because they are part of normal skin anatomy. So focus on smoother texture and less congestion, rather than chasing a poreless ideal. Beyond routine basics, prevention improves when you reduce hidden triggers that repeatedly feed congestion. Hair products are a major one, especially if blackheads cluster along the hairline, temples, or upper cheeks. Heavy pomades, waxes, oily leave-in conditioners, and fragranced styling sprays can migrate to facial skin, mix with sebum, and contribute to plugs, so keep hair products off the forehead and temples. Wash the hairline after styling if needed, and consider switching to lighter, non-greasy formulations if you see a pattern. Friction and occlusion are another common trigger, sometimes called acne mechanica. Tight masks, helmet straps, chin guards, frequent face touching, or resting your chin on your hand can inflame follicles and trap sweat and oil, making comedones more likely. Reduce friction where possible. Keep masks clean and breathable. Apply a light moisturizer before mask wear to reduce rubbing, and avoid thick, occlusive ointments under friction zones, unless the skin is truly chapped. Sweat management matters. Sweat itself is not dirty, but when mixed with oil and friction and left on the skin for long periods, it can contribute to congestion. After exercise, rinse or cleanse gently when practical and change out of sweaty clothing, especially if you are prone to body congestion. Small hygiene habits can also make a measurable difference. Clean your phone screen daily, change pillowcases at least weekly, more often if you are oily. Wash makeup brushes and sponges regularly, and avoid pressing your face against unwashed surfaces, because oils and residue repeatedly contact the same zones and can perpetuate blackheads. Makeup and sunscreen are compatible with blackhead prevention if removal is thorough. The most common issue is incomplete removal rather than the mere fact that you used makeup. So if you wear heavier products, double cleansing at night is often more effective and less irritating than scrubbing or piling on exfoliants. Regarding pore strips and extraction, it's important to be cautious. Pore strips can remove superficial plugs temporarily, but do not prevent recurrence, and can irritate the pore opening. And frequent squeezing or digging at pores risks inflammation, broken capillaries, post-inflammatory discoloration, and scarring. Repeated trauma can also make pores appear more prominent over time due to tissue remodeling. If you choose to extract occasionally, do it gently after a warm shower, use clean hands or sanitized tools, apply minimal pressure, and stop if it does not release easily. Pain and force are warning signs that you are damaging the follicle wall, which increases inflammation and can worsen acne. If you want occasional add-ons that do not disrupt the routine, keep them conservative. A clay mask once per week can help absorb surface oil for very oily skin, but it should not sting or leave you tight for hours. If it does, reduce frequency or skip it. A gentle AHA, like lactic acid once weekly, may help surface texture for some people, but it is less targeted for blackheads than salicylic acid and should not be introduced at the same time as a new retinoid. Whenever you add something, add one variable at a time and wait 1 to 2 weeks to judge tolerance and benefit. If you are sensitive and cannot tolerate salicylic acid, azelaic acid can be a gentler alternative that helps normalize keratinization and calm inflammation. It can be used in the morning or on non-retinoid nights, and it often suits redness-prone skin. If you are dealing with body blackheads or clogged pores on the back and chest, salicylic acid body washes or leave-on treatments can help. Use them consistently. Leave them on the skin for 1 to 2 minutes before rinsing, and avoid harsh loofahs or aggressive scrubbing that inflames follicles. Lifestyle can influence acne for some people, though it is rarely the sole driver of blackheads. Higher glycemic load diets with frequent sugary drinks, candy, and highly processed snacks can worsen acne in susceptible individuals, and dairy, especially skim milk, can be a trigger for some. So if you suspect a link, try a time-limited experiment of 6 to 8 weeks, reducing those triggers while keeping skincare consistent, rather than making extreme restrictions. Sleep and stress affect hormones and inflammation. Poor sleep can worsen stress response.